think what would be best to start with is, where is the prostate and what does it do?
Okay, the prostate is like a walnut-shaped organ that is just below the bladder and is situated in front of the rectum.
Okay.
So it is something that you cannot feel from the outside. A lot of people are mistaken. It actually points to the scrotum or the testicle, but the prostate is actually deep-seated in the body. Can only be felt through a rectal exam.
Oh, wow. Okay.
And its main function is reproduction. It produces this prostatic juice that contributes to about a third to a half of the seminal volume. It helps in nourishing the keeping the sperm alive, liquefying the gluey semen,
Right.
so that the sperm can be released to meet the egg. So this is very important for reproduction.
Okay.
It's a vital piece of the body
Yeah,
for men. Yeah.
Absolutely. I mean, I had to Google just now.
Yeah.
The
We had
prostate.
to look at the pictures
Because,
and all
I mean,
that.
I'm sure I've done it before, but then you tend to forget, and everything becomes clear again after you see the diagram. Now, last week we were talking about breast cancer. This week we're talking about prostate cancer.
Yeah.
And the doctor last week said, in very rare cases, men can get breast cancer as well. Now, can women get prostate cancer?
Oh, no. Woman does not have any prostate gland. It
Okay.
is only found in men.
Okay.
But is
So-
there a prostate-like cancer that women
No.
can get?
Nothing.
No,
Okay.
nothing.
All
Yeah.
right. Okay. So it's a very purely a man's disease.
Yes, that's right.
So, what would the
Reasons be?
Well, I would like to know what the symptoms would be.
Oh,
quite
but
honestly.
why? I think.
Why do
I think before
people
that,
get it?
Why do men get prostate cancer?
Okay, I think the main risk factor is age. As a person gets older, things go wrong in the body. Body cannot repair, mutations happen, and then there's abnormal growth.
Right.
So prostate cancer happens when the prostate cells undergoes some abnormal growth, it forms a tumor and cause obstruction, and then eventually it spread to the other parts of the body and cause death.
Does that mean an enlarged prostate leads to prostate cancer?
Oh, no.
No?
Yeah. So the prostate, very interestingly, it enlarges over time with age. It's like our hair turning grey, turning white. The prostate gets bigger and bigger. Having a bigger prostate does not equate to increased risk of prostate cancer.
Okay.
You can have a normal prostate size with prostate cancer. You can have a big fat prostate with no cancer.
Oh, I
Oh.
see.
And when you
Wow.
say it grows with age, how much are we talking about? Now you say it's a walnut size, right? Are we talking like melon?
No. It can grow to like ping pong ball,
Oh,
to
right.
a tennis ball. That's quite big because
That's
it
quite
starts
large.
off with the
Wal-
size of a walnut.
Right.
Yeah.
Wow, tennis ball sounds large.
That's
Yes.
large.
I have a theory. I think men get prostate cancer possibly because they are not having enough sex. Is it true?
Is that possible?
Is that, yeah?
There's a lot of people talk about this, and apparently there was a study that compares men who has frequent ejaculation, like more than 20 times, versus men who seldom ejaculate, like less than 5 times, and they found that people who ejaculate more often tend to have lower risk of prostate cancer.
Yeah, okay.
But that is a small study. That's not really substantiated by big population study.
Okay.
So it may reduce the risk factor,
Yeah.
like frequent sex, but it is insignificant compared to many other risk factors like age, other risk factors like family history. Now, family
Okay.
history is very important. It's got to do with genetics.
Oh, wow, okay.
So there's something new that we understand about prostate cancer recently. Okay? In the past, we look at just family history based on the men in the family. Like we will often ask, does your dad, your uncles, your brothers, any of them have prostate cancer? Because if any of those family members have prostate cancer, their risk goes up 2 times or more. But now, we also ask on the lady side, hey, your mom, your aunties, your sisters, any of them have breast cancer, ovarian cancer, pancreatic cancer, because prostate cancer and the rest of these cancers, they share some common genes, like the BRCA1 and 2 genes. So if the ladies in the family have all these cancer like breast, ovarian and pancreatic cancer, this man's risk of having prostate cancer goes up.
Oh my goodness.
Oh,
wow.
Yeah,
so
so-
mothers to the sons? Are you saying no?
It's not that it's not hereditary in the sense that they pass the genes
Right,
from
okay.
mother to son.
Okay.
But because they share some common genes, so if your mom has breast cancer, your chance of having prostate cancer goes up.
Oh my
It
goodness.
doesn't mean you will have.
Right.
Yeah.
Okay.
It doesn't mean that you
Just increases the risk.
just
To us
Okay.
guys, it doesn't make any sense. We're like, why? Why?
Why? Yeah, exactly.
Okay, anyway, let's continue to talk to the doctor on the Big Show TV. Here's Elijah Woods with 24/7 365 on KISS 92.
Spend 3 years and sit.
It's just something it's like so hard to hear, right?
Well,
Even breast
I-
cancer
it's
for
like,
women as
what
well.
did we do? It's like-
I move in a lot older group of people, right?
Yeah.
And a lot of us are very worried about prostate cancer and how will we know that we get it at an early enough stage? We catch it at an early enough stage.
Yeah.
So what am I looking out for? As a 68-year-old, what am I looking out for?
I think you see the interesting part of the anatomy of the prostate is that the urine tract goes through the central part of the prostate.
Yeah.
So when the prostate gets bigger and bigger, they start having obstruction. They have difficulty passing urine. They may go toilet more often. But this is only a sign and symptom of an enlarged prostate. It doesn't tell you that you may have prostate cancer.
Right.
In fact, most prostate cancer nowadays are diagnosed just on cancer markers.
Oh.
So they have no
Wow.
symptoms, they go for health screening, and then they found that their cancer marker goes up. So there is this cancer marker that's commonly used, is called prostate specific antigen, or PSA for short. So most times when you go for executive health screening, you will have this PSA done.
right.
And we normally recommend them to start checking at the age of 50.
Okay.
Unless you have a positive family history, then you start checking at 40.
You see, but I run by this thought. How many of us, just say Glenn and myself,
Yeah.
how many of us know whether or not our uncles had it? We don't know that medical history.
Well, then you need to ask
Yeah.
whoever is.
No need lah. I
still
tell you,
around.
if you ask, you get even more worried. Just go for your regular checkups.
Yes.
I think that's
Cancer.
also okay. Right? If not, you go through your family tree, this and that.
Exactly.
Then after you make yourself worry even more. Just going for your yearly checkup already can be quite stressful sometimes. But at least you are checking yourself, on an annual basis.
Yeah.
Is
Doctor,
there
what do you
a-
think?
Yeah, go
but I
ahead.
think there's a word of caution about all this health screening, and that is must not go too young, too early.
Okay.
Because I've seen some men who have gone for all this health screening and they picked up some abnormal PSA when they are 35, 38 years old.
Ruins
Too
the
young,
life.
too young. Because this cancer marker PSA is not disease specific. It is produced and released by the prostate. So
Right.
if the prostate has some inflammation, then the PSA may be high. is it?
Oh.
So then this patient gets so worried.
Right.
Right. So it doesn't necessarily mean he will get prostate cancer
No.
either.
Yeah,
Yeah.
but
Right,
that's
okay.
another thing, doctor. I mean, you hit the nail on the head. Some people, when they worry, then everything goes haywire.
So I think the audience needs to know that this cancer marker, while it's very good, it's not perfect.
Yeah.
So there's something new in the market. It is a derivative of the PSA called Prostate Health Index. So you try to eliminate some of the confounding factors like inflammation, infection, and an enlarged prostate. See, because when an enlarged prostate, when the prostate gets bigger and bigger, the PSA will slowly creep up also. So then when your PSA is a bit higher, you're not sure. Is it due to enlarged prostate? Is it due to cancer or is it due to inflammation? So the new cancer marker called Prostate Health Index, or PHI for short, helps to eliminate some of these confounding factors.
Okay.
I just want to find out, like you said, besides it runs in the family history, health screenings and stuff like that. Is there any way physically or any symptoms physically that men need to look out for
Yeah.
to send them off to the doctor to check for prostate cancer?
I think at this early stage, really there's no symptoms.
Oh,
But by the time you have painful urination, blood in the urine, you have bone pain, that is a very late sign.
where?
Hold on, bone
where?
pain.
You see, prostate cancer can go to any parts of the bone, to the spine, to the hip,
Oh, shoot.
to the ribs.
So wait. So if you
Everybody's aching all over. I know that's what y'all are saying.
wait, sorry. So if you feel, say, a pain in your spine or your hip, it could be prostate cancer? Is that what you're saying?
For elderly men, yes.
And elderly, you're saying 50 and above.
Yes.
Wow.
Yes.
No, that's not. Oh, okay.
That's what. Yeah, no. But he said
Elderly.
because he said that's
54
when you need to
already.
check.
Especially
Elderly.
if the pain is persistent.
Persistent, like constantly there.
Persistent, severe, I think it definitely needs to get checked.
Wow. Who would have thought? Huh?
I know,
That's
not bone pain.
Oh my goodness. Everyone's like, oh, wait, hold on.
Now, I want to go back to the blood in the urine. I know that there are times when you can have blood in your urine, and it's only picked up when they check your urine because it can't physically be seen. Are we talking about that, or are we talking about visible blood in the urine?
Okay, usually for locally advanced prostate cancer, they will have visible blood in the urine. The microscopic hematuria, usually due to some other things, maybe like stones, bladder cancer, kidney cancer.
Okay.
But to have locally advanced prostate cancer in an advanced stage, they'll have bloody urine.
Bloody
Yeah.
urine.
I had bloody.
Not
I
a
had-
common symptom, huh?
Yeah.
Yeah,
I had
yeah.
bloody urine when I was in my 20s. No, I got a shock of my life. It was it's just an infection. I got like
Like a UTI.
what do you call I had to take some antibiotics, and like 2 days later it was okay. I think maybe it was because it was during the time I wasn't wearing any underwear
Oh.
at that time.
And you probably got an infection.
Well, that's what my GP told me.
Okay.
Okay.
All right.
Yeah, but that was quite scary actually.
I'm sure.
Yeah. Blood of any sort from anywhere that's not supposed to be coming from is scary.
I know, right? Okay. Are we
Traffic.
going back on air?
Traffic.
Okay.
Yes.
Kiss 92 traffic.
There are a couple of accidents to look out for. The first is on the AYE towards Tuas at the PIE exit, and the second is on the TPE towards the PIE. That accident is after the KPE exit, causing a backup all the way to Pongal Road. Avoid lane 1. And finally, on the ECP heading into the city, a vehicle's broken down after the MCE AYE exit. Wherever you are this Wednesday, stay safe.
Welcome back to The Big Show and The Big Show TV. Our guest for today is Dr. James Tan, urologist from Mount Elizabeth Hospital, and we've been chatting about prostate cancer. Remember, it's prostate cancer, not prostrate cancer. Prostrating is completely
Slightly
different.
different.
Yeah. So, doctor, can I ask you, what measures can be taken to prevent prostate cancer?
Okay, there's no prevention in prostate cancer. There's no immunization or vaccination. So I think you really need to just adopt a healthy lifestyle.
Okay.
Eat healthily, exercise regularly, don't smoke, don't be overweight. I think that would be good enough.
Don't
that's,
drink as well, or what?
I think it's not related to prostate cancer.
Okay, so
Finally, something that's
yeah.
not
So if drink is not related to prostate cancer, what about foods? Fried food, fatty foods, things like that.
So I say healthy, balanced diet.
Yeah.
So there are some studies who show that if you eat a lot of animal fat, a lot of processed food, you increase the risk of having cancer,
But
including prostate cancer.
That's what all the doctors say, week in, week out. It's about a healthy lifestyle, healthy diet, no smoking.
Yeah.
Make sure you exercise and stay at your optimum weight.
Yeah.
That's basically it, right?
Yeah.
To lead a proper healthy lifestyle. Give yourself a chance.
So I'm
But
trying.
are we really living, doctor? If we, abstain from this, abstain from that, and live in fear, what's your advice actually? I mean, to be realistic.
No, I think as part and parcel of healthy lifestyle, I think it can be a joy. Why should you be living in fear?
Because it's
Exactly,
mental
right.
well-being
Go
as
and
well, right?
exercise,
Yeah.
enjoy your food. I think you can still enjoy food that is not so salty, not so sweet, not so oily. I think you can still enjoy life. Why should you live in fear?
with where the prostate is located and how it is connected.
I love it.
Yeah,
Are you guys watching FD?
You
The way
gotta
he's
watch this. How it's connected.
You got to Google online. Go
Yeah.
online and Google.
I'm
where
trying
is the
so hard to be
prostate.
politically correct. What are the treatments left? Is it just if you get prostate cancer? Is it just chemo and radiotherapy? Well, what are the treatments
okay.
available?
So, if it's the treatment depends on the stage of the disease. So we can simply divide them into like early stage. That means when the cancer is still within the prostate, versus cancers that have already spread to many parts of the body, like the bone. So we call that metastatic. So in early stage cancer, while the cancer cells are still confined within the prostate, the aim of the surgery is to take away all the cancer cells. That means to remove the whole prostate. So for many, many years, this is the gold standard. The alternative is to do radiation treatment, which is to shine in radiation energy into the prostate to kill the prostate cancer cells. So that's early cancer. Between surgery and radiation treatment, results are very good. But when you are young, if the patient is young, we prefer surgery as first choice. Because if they can live, say like longer than 10 to 15 years, we normally will advise them to go for surgery. They will enjoy many years of cancer-free life. In radiation, we typically offer to those who are older, those who are not fit for surgery, or those who are just too scared to undergo surgery, or cancers that are a bit more locally advanced, we can offer them radiation treatment. Because in radiation treatment, other than side effects like some injury to the surrounding bladder, rectum, they can cause some burning, pain when you pass urine, blood in the urine, blood in the poo-poo. About 5 to 10% in the long run, they may develop a second cancer just from the radiation effect.
I
So you can get a very severe, aggressive cancer of the bladder or the rectum. So we try not to offer them to young patients because then they have many more years to develop this kind of complication.
Wow.
When you say young, how young are we talking when you say young?
Oh, my youngest patient, prostate cancer, is 42 years old, no? So we usually think that it is in the elderly, but I've got patients in the 40s. So if they are in the 40s, they're in the 50s, we'll be very hesitant to offer them radiation treatment. We would normally advise them to go for surgery. By the time they are 60s, they have equal choice. By the time they are in the 70s and late 70s and 80s, usually they may not be fit for surgery.
Right, yeah.
But having said that, my oldest patient who have undergone surgery, he was 84.
Oh, wow.
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 So as long as the heart is strong, they can take it. We send them to a cardiologist for assessment. And if they want it, we'll do the surgery for them.
Okay.
Okay. All right. We're talking about prostate cancer, and we don't want to fill your morning with doom and gloom here, but it's always for your information. And
Absolutely.
this is very, very important to be educated in this area. Yeah. Let's continue to talk to the doctor on the Big Show TV. It is 8:23.
Kiss 92 Time Check brought to you.
So we've spoken about old and young. Is there a particular group of people that's more prone to prostate cancer?
In terms of age?
Any sort
Type.
of type of person?
Okay. So a lot depends on the ethnic group. We know that the excuse me, the African American, the blacks, they have an increased risk of prostate cancer,
Okay.
whereas Asians have lesser risk of prostate cancer.
Among Asians, is there any group that has a higher...
Not really.
So it's a
We don't say.
DNA almost.
It's a DNA thing.
So let's say 20 years ago, America, Europe, Australia, prostate cancer was number one, or he has always been number one. Whereas in Singapore, 20 years ago, prostate cancer was like number 6, and after it crept up slowly, it became number 4. Now it's currently the most common cancer in men.
Oh, no. Why is that, though? I mean, why has it crept up like that? Do you know?
I think there are a few reasons. One is I think men, we are living longer. So if you live long enough, higher chance of having prostate cancer. And also we are detecting more prostate cancer with all this health screening.
More
we do
awareness.
a lot more cancer markers. And interestingly, I think it may be related to a reduction in some of the other cancers, like colon cancer. A lot of people are going for colonoscopy.
Yeah.
Even the polyps, all the polyps are being removed.
Yeah.
And then lung cancer used to be very common, but with all this anti-smoking campaign, in Singapore there hardly any place to smoke. Right?
That's true, yeah.
So I think lung cancer also has dropped. Liver cancer has also dropped because there's a lot of vaccination for hepatitis B. Yeah. And then even gastric cancer, people have gone for scope. They found that, there are all these ulcers, gastritis can be treated with medication. So all these cancers drop. But prostate cancer, there's no true prevention. And then with an aging population, maybe westernization of our diet also increase of prostate cancer.
Yeah.
So in Singapore, I just checked the latest cancer registry. About 7,000 men has prostate cancer, newly diagnosed prostate cancer per year. This is based on the 2017 to 2021 cancer statistics locally, which translates to like 20 new cases a day.
That's a lot.
Yeah.
That is a lot.
And of all the cancers in the men in Singapore, 1 in 6 are prostate cancer.
Oh my gosh, that's a high number.
1 in
1 in
6.
6 is like, oh.
Yes.
Okay, doctor, I want to talk about post removal of the prostate. So once the prostate is removed, because it's such an important organ and it sits between the bladder and the urethra is connected through it, does the urethra get rerouted? What happens to the person after that?
Yeah, so you see, the prostate sits below the bladder. So once you remove the prostate, we actually need to reconnect the bladder to the urethra, which is the urine tube below the prostate.
Yeah.
So once the prostate is removed, there will be no more seminal fluid.
So no babies, right?
No more babies, yeah. So but patient can still have sex. Still
Oh,
can have
right.
orgasm.
Okay. Okay.
Hold on, doctor. We'll go back on air.
Kiss 92 traffic.
On the MCE towards the KPE at the ECP Changi exit, a vehicle's broken down. Also on the TPE towards the SLE, another vehicle is having trouble after the Pongal Road exit. As you go through your Wednesday, if you spot anything else, our number is 885550
Welcome back to The Big Show and The Big Show TV. We've been talking to Dr. James Tan, urologist from Mount Elizabeth Hospital. And on the topic of prostate cancer, and Angel had a very interesting question on The Big Show TV earlier.
Yeah, so Dr. Tan, I wanted to ask you, after someone's diagnosed with prostate cancer and they have to have their prostate removed, because it's such an important organ, sits right below the bladder, somewhat connected to the urethra, what happens to the peeing process after removal of the prostate? And is the man still fertile in terms of having babies?
Yeah. So once the prostate is removed, you have no more seminal fluid, so cannot have baby anymore. But quite often the patient can still have erection, can still have orgasm, but nothing comes out. So it's a dry ejaculation.
Okay.
So cannot have baby anymore. Okay. In terms of peeing, because we have to reconnect the bladder down to the urethra, so they should be able to pee like normal. But for a short period of time, we need to put the catheter into the system. So they will have to carry a urine bag for a week to 2. Once the catheter removes, he may get some stress incontinence for a few days to a few weeks. Some very old men or people who have a very big prostate, they may get incontinence for a few months. But eventually, most of these will recover.
Okay.
So they will pee like normal. They will not need diaper for the rest of their life, which is something that freaks patients
People out. Yeah, for sure. I just have a question continuing from the not being able to have babies part. Can a man freeze his sperm when he finds out he has prostate cancer for future use?
Of course.
Oh, you can. Okay.
You can actually do a storage of your semen. In fact, after the prostate is removed, the testicle, the factory that produces sperm, is still working. So you can actually still go back into the factory and retrieve sperm for IVF.
Okay. Wow, that's good news for a lot of people.
But most patients at that age, they're not interested in babies anymore.
Because it's an older thing.
They're more concerned about urinary control.
Yes.
And the other thing they're most concerned about is erection. So I'd like to talk about this erection problem after surgery. Now, very interestingly, the nerve supply to the penis is lying very close to the prostate. In fact, it is lying on the prostate. So traditionally, when we remove the prostate, the nerve supply will be damaged or removed. So many years ago, once you go for prostate surgery, you're totally impotent.
Oh.
But nowadays, with robotic surgery, we actually can preserve the nerve. It's almost like peeling a layer of a layer of the onion like that.
Right,
So
yeah.
you just peel the nerve off the prostate, remove the prostate, and then preserving the patient's erection.
Wow.
So you see a lot of patients are just scared
Yeah.
on
That
sort of
bit.
going for surgery because
Yeah.
of all these factors. So we can reassure them.
Wow. Okay.
Okay.
But of
That's
course,
great.
how successful we are will depend very much on how aggressive the cancer, how close is the cancer to the margin, the lining, the capsule of the prostate. So there are a lot of factors, and a lot depends on the skill of the surgeon as well.
Okay. All right.
Wow.
Well, thank you so much, Doctor, for talking to us this morning. It's been very enlightening.
Very, very interesting stuff. Yeah.
And we hope you had a good time with us as well. Thank you so much. We've been speaking to Dr. James Tan, urologist from Mount Elizabeth Hospital on prostate cancer today.
Thanks for tuning in to The Big Show's Good Morning.
All right, we are back on The Big Show TV, and we have a very special guest that has just joined us in the studio. She is the founder of CaringSG, Dr. Lim Hong Huay, but she's also the wife of one of Kiss 92's friends, Dr. Leong Ho Nam. Thank you so much for joining us today.
Thank you for having me.
Finally, we get to meet the woman behind the man.
True.
Okay, so we're going to be talking about CaringSG. Tell us first what CaringSG is all about.
Well, CaringSG is a charity that supports caregivers of persons with disabilities as well as parents of special needs children. So we started in October 2020, but very quickly we are now an institution of public character. So we are quite well recognized in the field now. And we have programs that help caregivers to find support groups. So we help to match them to the appropriate support groups based on their children's diagnosis and their preference. And we also conduct events, webinars to connect caregivers to the partners, inclusive partners in the ground, to grassroots. We train grassroots as well. And we also do train caregiver volunteers who are empowered to give back, and we buddy them with another caregiver in need.
Oh,
and
wow.
we also have professionals who help the caregivers to navigate the system, which can be quite complicated. Yeah.
So the caregivers are not always professionals.
No.
Oh, wow, okay.
So this we are supporting informal or family caregivers of persons with special disabilities and children with special needs.
Oh, wow.
So it's people with disabilities and children with special needs.
Yes, caregivers.
The caregivers of those people. But so that does not include, for example, the elderly with medical problems.
We focus mostly
On disability,
Yes,
yeah.
disability.
Okay.
So there is another group that looks
Okay.
at supporting caregivers of those with mental health illness and
Yeah.
elderlies.
Yeah.
So that's another
Okay,
charity.
that's
but
another charity.
We
Okay.
focus on those persons with disabilities.
Disabilities.
And children with special
But as you
needs.
said, in such a short period of time,
Yeah.
CaringSG is so established. Everyone has heard of CaringSG. Now, doctor, I just want to know, how can families support their caregivers and their and persons with special needs
Yes.
so that they can stay bonded as a family?
Yes. It's actually very important to have the family to wrap around the caregivers and the persons with disability. And there are many ways that you can support. Firstly, you can be very understanding. A lot of times we find that when caregivers receive the diagnosis of their children, often their children, right, they tend to get into this mode of grief and they will close up. And it's important for the families to not probe too much or, try to dismiss the problem. Some of the extended families will say, nah, he will outgrow it. He'll be fine. My so-and-so only started talking at 4 or 5 years old. And when you dismisses the problem, the child with the special needs or the persons with disability eventually will not be able to become themselves and be able to grow up in an environment that is accepting, right? So firstly, if the family is accepting and is able to open up and have the conversation, that's very important. I think that's the best indication of love, right? You're accepting and you allow the person to be the person who they are, Yeah.
Why did you start CaringSG?
It is a personal journey.
Okay.
I went through, my oldest is already 21 years old.
Okay.
And the youngest is 14, and then there's in between 16. So I would say about 7 years ago, when I realized the diagnosis for my youngest one, he's also autistic, and my eldest is autistic. It was very hard for me, and I have to give up my work in the hospital. And I'm a very trained pediatrician. But the thing here is, because of the children's need, I will have to spend more time with them. And in the course of spending time with them, after I left the hospital practice, I decided I need to be with other people. I need to open my circle of connections so that I can stay connected with the resources. So I joined a support group through friends, and I realized in the support group for the first time in my life that I need my fellow caregivers. For the first time in my life, I realized I'm not alone.
You're not alone.
Yeah. Previously, I was just a professional, trying very hard to help my kids in every professional way. But when I realized that I have other caregivers as friends, it gives me the energy, the power to say, hey, we can hold hands together, we can share information. Even at 12 midnight when I'm depressed with my kids, I can text them and they'll reply to me and they'll send me encouraging notes the next day. So that really energizes me and keeps me going. So when COVID struck in 2020, a lot of my caregiver friends in the support group were suffering. And then I have to...
just hold that thought. We will
we'll go on air.
Yeah.
I can ask the question if you want.
Yeah.
Yeah.
Kiss Kiss 92 traffic.
On the MCE towards the KPE at the ECP Changi exit, a vehicle has broken down. On the BKE towards the PIE at the Mandai Road entrance, another vehicle has broken down. And then finally, on the ECP into the city after the MCE AYE exit, look out for a vehicle having some trouble there. Wherever you are this morning, stay safe.
Welcome back to The Big Show and The Big Show TV, our second guest for today. And we've already been speaking to her on The Big Show TV. Is Dr. Lim Hong Huay, the founder of CaringSG. And we're finding out what the spark was behind CaringSG. And I have to say that, the reason has touched me.
Yeah.
You
Okay.
take it away,
Okay.
Angel, because we're going to have to ask you the question again.
Well, so Dr. Lim, you did share with us the story behind why you started CaringSG, and we know it's a very emotional sharing from you. But if you could, just for the person that's listening to us on the radio, tell us why you started CaringSG.
Yep. So, as I mentioned in my previous sharing, it was a very personal journey. And subsequently, during COVID pandemic, there was a lot of caregiver friends who were falling through the cracks. That's when I gathered some of the caregiver support group leaders, almost 20 of them. There are 20 support groups, out there, even before CaringSG. And some of the groups have been around for 10, 20 years. So I said, let's gather together, set up a charity, let's get some funding in, and we do this on a big scale. Because there are a lot of caregivers out there who doesn't know we are around to help each other. So I started CaringSG, put in projects, Project 3i, which I think has been in the news. And after 3 years, we have proof of concept, and we have data to show that helping caregivers by caregivers reaching out to each other, by caregivers supporting grassroots, by caregivers working with partners actually worked. So there are definite positive results that help them. So I would say setting up CaringSG is a way forward for caregivers to give back to the community and to connect with other caregivers.
Okay.
Caregiving is a 24/7 responsibility. How do these caregivers, because I find it very difficult to understand, how do they care for themselves? How do they remain who they are?
Yeah.
How do they do that?
That's a really good question. I told a lot of my caregivers who are actually running through difficulties, in Carewell, where the caregivers are high needs. I told them self-care is a survival skill. If you want to care for the person you love, you have to care for yourself first. Like in an aeroplane, they tell you the oxygen mask drop
You
down,
do it
put it on
first,
for
yeah.
yourself before
Yeah.
Yes. So there is a consciousness you have to build as a caregiver. We tend to burn ourselves out. So you have to know yourself, okay, I'm very tired, I'm very snappy. It means I'm burning out. So how do I set aside time for myself to recharge? How do I connect with people who gives me positive energy? Right? So it's a self-discipline, something that we work on. And we have going to launch a Care Forward campaign in December. Maybe I'll share that next time. Basically, it's talking about how caregivers can heal ourselves. How can we have self-care? So that would be it.
Definitely something my mom should get on, for
Yeah.
sure.
Oh, absolutely.
Because my mom is, I bring the story up over and over again. My dad had a few strokes, and they have a helper that's specific for looking after my dad. But because my mom feels so guilty about being able to live her own life, that she literally looks like her life has been sucked out of her. You know what I
Exactly.
mean? And
Yes.
and if you ask her to go do things on her own, she won't. Because she feels bad for having a good time.
Yeah, she feels a
while
bit
my
guilty.
father is not, So it's
Yeah.
very, very difficult for those that are caring for the ones that can't care for themselves.
Yeah.
It's very, very hard.
Okay. Let's go back on The Big Show TV, shall we? It is 8:44.
Wake up.
Glad
So, just speaking from a personal experience, what can I say to my mom? She's probably not going to go into a community or not going to reach out to anyone. She's very introverted. How can I convince her that she needs caring for as well?
I think caregivers also need people to care for them. The very fact that you are thinking about her shows that you love her, right? So you need to firstly talk to her as a person, the person who have a caregiver. Sometimes we can start by talking to her to say, how was your childhood like? How did you, did you think that you'll be in this position? How do you feel about it? What can I do to help you? And be there to just listen to her. Everybody has dreams.
Yeah.
Everybody has things that they wanted to do or things that recharge them. So if you start listening to her to find out what recharges her. For my mom, she likes to watch YouTube videos of travel, and she loves to look at the beach, things like that. So find out what makes her tick. So it starts from there.
Like
And
a
then-
little hobby to keep their mind off
yes,
things. Yeah.
yes. So
that's
it's,
a good
it's
idea.
not about what you want for her, but reconnect her to herself.
Yeah.
That is the most important.
Yeah.
thing.
Yeah.
Yeah.
That's a good
But
idea.
even that is not easy, huh?
No.
Yeah.
Because she's so connected to your dad.
Exactly.
She loves your dad so much, she finds it very hard to
Pull away.
to
Pull
move
away,
and
yeah.
and I think it's your dad who recharges her, quite frankly.
Possibly,
But unfortunately,
Yeah.
as you said, it's also draining, her energy. And,
I mean, she literally looks like,
Yeah.
you've seen those movies where you get the soul sucked out of you. That's what she looks like. A quarter or even a third, an eighth of what she used to look like.
Yeah.
You know what I mean?
Yeah.
Yeah.
So I realize as a caregiver, I can only be a good caregiver if I'm happy.
Yeah, of
I
course.
can, because I looked after my mother-in-law who has cancer as well as dementia as well for about 9 months, and I really love her. She's a wonderful friend. But with my 2 kids, 3 kids and 2 of them with special needs, I got her to stay, my mother-in-law to stay with me because I want to care for all of them.
Of course.
Right.
After a while, I felt that I was just like a screaming banshee.
Going crazy, right? Yeah.
And I had to be honest with myself and said, I can't do it. So I reached out to my brother-in-law, my sister-in-law, my husband. I said, I'm sorry, I really love Mom, but I can't do it.
You need
he said,
help.
Yes, I need help. So we make rearrangements in our family so that I can then visit her and help her with other things, So the family came together because of that. So we do need to also find out who is around us, who is around you, who can help you in that journey.
A
you know.
wider support group.
Exactly,
Yeah.
yes.
Yeah.
So we care for our caregivers, we care for our dependents if we learn to reach out to our own village of support.
Yeah.
So as you do that, as you bring people into her life to talk to her, sit with her and be with her and journey with her,
yeah.
she will start to feel that support.
Yeah.
Yeah.
So she will start to realize that she matters as well, not just your father.
Yeah.
I think your comment of helping her reconnect with herself is very, very powerful.
Yeah, it is. And
Very,
it's not
very
easy
powerful.
for a lot of the
It
caregivers.
is, yeah, it isn't. It isn't.
Because all of their lives they've been
Yeah.
doing that, and it's
Yeah.
been routine. So change
Yeah.
is not easy at
It's
all.
not.
Yeah,
Easy.
it's so difficult looking after the aged, especially
Yeah.
someone you love,
Yeah.
who is unwell.
To watch them sort of
Yeah.
like waste away, it's
Exactly.
very hard.
Yeah.
Yeah.
Yeah, and I think more and more these days, some people can't really handle it themselves.
Yeah.
So which is why they're getting like the helpers to take care,
Yeah.
of them, or sometimes they also send the aged to like a nursing home, as well,
Yeah.
right?
That's tough as
Because
well.
some people can't deal
can't
with
deal
it.
with it.
Okay,
Coming up.
we'll go on there one more time. Lost Frequencies featuring Tom Gregory. That's Dive right here on Kiss 92, all the great songs in one place. It's so nice to have Dr. Lim Hong Huay, the founder of CaringSG, join us this morning. And we just found out what her spark was behind CaringSG. And we're also talking about the fact that, if you're in this position right now where you're taking care of someone and perhaps maybe having a little bit of difficulty and feeling all stressed out and all that, well, that's CaringSG.
Yeah. You can head to their website at caring.sg.
Yes.
Right?
You need a support system.
Yes.
Tell us
So important.
tell us who caregivers are. I mean, for us, we think caregivers are family members. Caregivers are children or parents, or even helpers these days. Who are the caregivers you're targeting?
For CaringSG, we are targeting caregivers of those persons with disabilities and special needs children. In Singapore, if you look at the statistics from MOH, MSF, and MOE, there is a total of about 350,000 persons with disabilities and special needs
Wow.
across all ages. Okay, that falls under the WHO definition of disability. That's not including those with mental health illness and elderly that can go up to around 60,000 if you add them all together. So that's about 19% of the population. So if every person with disability or mental health illness or elderly has one caregiver, that's another 19%. So if you look at it, actually every one of us can be a caregiver. Yeah, and actually, honestly, every one of us will become disabled in our lifetime.
At
So
some point, at some point.
Knocking on wood.
you know, we have good, very healthcare systems, so we age and we can
Yeah.
kind of like gather disability as we age.
Yeah.
So we will have caregivers. So this awareness of everyone can be a caregiver, everyone will be a caregiver one day, and everyone will need to receive care one day is important.
Yeah.
Yeah.
Right, so it's not something very rare. It's actually part of our life.
Yeah.
So we all need to learn to get ready to caregive one day, and
Yeah.
if we do, handle it by looking for support system, looking at yourself. What is your personhood? How do you journey through that and maintain your personhood?
Yeah.
So that is a life skill.
That's
you know.
important.
That's being
Yeah.
realistic.
It is.
You know, like
And
I always say, growing old sucks.
Yeah.
But all of us are gonna get there.
It does, though. Growing old does is awful, but I mean, like what you said, it's always better to be prepared. And if you're prepared, then you are armed with the knowledge and the know-how of how to do it best,
Precisely,
right?
precisely. Is that why we have events like the Purple Parade and Care Forward?
Yes. So Care Forward will be focusing on the caregiver's personhood and healing, right? Purple Parade, it's a mass event where CaringSG has been participating in the parade for past 3 years. We have a booth, and in the booth you'll find all the little things that the caregivers and their persons with disability made at home. So they are little cute stuff, and you can have a look at Uplift, which is actually a book that you can receive if you have donations to us. And this book is a very special edition because it is collaboration between caregivers and a person with disability who is a calligraphist, and a public supporter who is a painter, as well as a poet who is a doctor. So it is the whole community coming together producing the book. It's a lovely book. You can go to the website and take a look. And then we have a wall of support where you have information on different 25 support groups in CaringSG and how you can connect to them and what kind of support they can give. So come to our Purple Parade booth.
Okay.
Yeah, and explore the world of support. Yeah.
And your Purple Parade is happening this weekend.
Yes,
It's happening
come
at
join us.
Suntec City
Exactly.
this weekend from 3 to 7 p.m. Admission is absolutely free. It's supporting the inclusion and celebrating abilities of persons with disabilities. And everyone wears purple, right?
Yes.
Yes.
That's
Yeah,
awesome. Yeah, that's great.
So
This
remember to
weekend.
visit the CaringSG booth, okay?
sure.
Yes,
Yeah.
yes.
So you mentioned this in passing just now. So, as an organization, how can people help you?
Well, donate to us. That's one.
Through your website?
Yes, through our website. We have campaigns. So our first campaign is Uplift right now, and we're going to launch another one, the Care Forward campaign, in 1st of December. So watch out for the news. And certainly come and volunteer. Like I say, every one of us will be a caregiver one day. When you volunteer, you actually get to know what could be happening.
You learn more,
Right, you
yeah.
learn.
Yeah,
You really learn by investing your life, walking into the lives of the people, of caregivers, of persons with disabilities. So come join us and volunteer. We really need help. Like I say, 350,000.
Yeah.
CaringSG can't do this with our staff. We need everyone
need
in
help.
the community.
Yeah.
Yes.
Yeah.
You're amazing. Thank you so much
Yeah.
for founding CaringSG. We've been speaking to Dr. Lim Hong Huay right here on KISS 92.
Wake up feeling good.